you all for your attention in advance. As she mentioned, I work at Ponte Vedra Valley Funeral Home, and we're also Cemetery and Cremation Center in Ponte Vedra Beach. I consider myself a trusted servant, and I consider it a privilege to be able to wipe tears and hold hands. It's a major part of what we do in guiding and advising people during one of the worst times in their life, and I certainly consider it a privilege to be able to do so. What is my message? Why am I here today? Well, first, I want you to understand that your responsibility as a healthcare professional does not end when your patient dies. And that's very important for you all to understand starting out at this particular stage. The journey you've committed to traveling with your patient does not end at the point of their death. Instead, at the point of their death, you merely replace their hand to hold the hand of your patient's loved ones. Second, I want you to understand that funeral directors are state licensed death care professionals and members of the allied health community. Thus, your interaction with such individuals should be guided by a mindset of cooperation with a respected colleague. It's very important for you to understand right now is that your cooperation is so key to what we do. That collaboration with the death care community begins when you make what is called the first call to the funeral home. Whether you're a nurse working in a hospital, in home health care, for hospice, a nursing home, or an assisted living retirement community, you will eventually have to make a first call. What the funeral service professional needs you to know before you call is very important. This is what we use in our particular funeral home. It's called a first call sheet. This is a sample of some of the information that we'll ask of you when you call the funeral home to report the death. This is a sample of what it looks like for an adult. You'll see the name of the deceased, their date of birth, their date of death, the time of death. All of those things are extremely important. It's important for you to know where you are and where we need to come to receive your former patient. Sometimes I'll get calls from nurses who are, have lost their patient, and when they call and they ask for some of this information and they don't readily have it available. They're having to place me on hold and ask the family. As soon as your patient has passed away, take a moment to gather yourself. It's okay for you to take a few moments. It's perfectly understandable, especially the first time it happens, for you to be nervous, for you to be emotional even. I know that you're taught or being taught, you do end up having to keep a certain level of professional distance, but the reality is we're human. You get attached to the people that you're working with, okay? And it's okay that that happens. So just take a few moments, gather your thoughts, ask the pertinent questions of the family so that you're ready to give us the information that we need when we call. And it's also important too because at that moment you are feeling especially nervous. The family is understandably upset. Even if they knew it was coming, they're still not prepared for that moment when their loved one takes their last breath. And then even if you're in a hospital, it's particularly challenging because sometimes that person may have come in and it may have been a situation where the family thought they were going to walk back out. Maybe they weren't terminally ill. Maybe they had not been under hospice care. So at that point, it is particularly important for you to take the time to just go ahead, take a break for a moment, and get that information ready. You'll notice here that one of the things I end up having to ask when I get that call is the type of facility where we're in. If it's a nursing home or a hospital and they're in a room, please have the room number available. I'll need your name, your telephone number. I've talked to some great nurses, and sometimes they're even willing to give their cell phone number. And then I'm going to ask you something that is particularly key, which is, who is the doctor who will be signing off on the death certificate? Now, if you are with hospice, a lot of the time, certain hospice facilities, I have to end up calling them anyway. Whoever may have been the primary care physician for your patient may not ultimately be the person who's going to sign the death certificate. But in most other settings, whether it be the hospital, nursing home, etc., usually whoever has been caring for the physician is the person who will be signing off on the death certificate. And sometimes I have talked to nurses who don't seem to know who the physician is. So again, it's just very, very key that you know this information. And then finally, the next of kin information, whether it be a son, a daughter, a spouse. It's very helpful if you know their name, are able to tell me their relationship to the person who's deceased, as well as a contact phone number, because from the point at which I get off the phone with you and probably make one other call, then I have to be able to call. I've had some nurses sometimes and medical assistants who will ask me how long it will take for us to arrive. Sometimes they're very upset, and again, completely understandable, but just understand it usually takes at least an hour for us to get to the location. I mean, that's just on average. And depending upon, the proximity or the lack thereof from where we're located to where the death is taking place, it can take longer. Okay, so just be patient with us. It's perfectly acceptable for you to call back after an hour if no one's arrived and, and question the time of arrival, but at least give us an hour, please. All right. So now let's talk about why this initial vital statistic information is so important. All of the information collected by the funeral home representative during the first call is required to begin the death record, which ultimately is utilized in generating the death certificate. If you're a medical assistant in a doctor's office at the hospice facility or hospital, the funeral home will contact you following the first call, because we have to verify that the doctor of record that you've given us is actually the doctor who's going to be signing off on the death certificate. Okay? So the electronic death record system is the system utilized by all allied health professionals involved to generate the death record. And so part of the information that I'll be asking when I call, say for example, the doctor's office or the medical records division of the hospice facility, or even sometimes the medical records division of the hospital, is for the ME number, which is the physician's license number, and in some instances it will be called what's called an OS number, which means that the doctor is an online provider. If it's an ME number, that means that they'll be faxing the information manually through the EDRS system. It's an online provider. What that means, they give us the cause of death. We have to go in usually and manually type that information into the system. The way it worked out when they went from paper system to electronic system, the physicians are not required to type in anything. We have to do it as funeral directors. So what happens is that you have two different systems. Usually, if they have an ME number, that means that they're just writing it in. We have to go in and type it into the system and upload everything. But if they have an OS number, that means they're one of very few physicians who are online providers, where they enter it all in themselves. But that's very rare. So I will be asking you for that information when I call. So again, it's just great if you don't have to necessarily place us on hold for an extended period of time to get that information. But more than likely, when you get into whatever facility where you'll be working, this is some of the things that will be part of on-the-job training, hopefully. So let's talk about Florida state law and time requirements. There are so many state laws regarding mortuary science and death. I'm actually still provisionally licensed right now because I do have to still take my state board examination, which deals with all of the state laws. So let's talk about that. The doctor has 72 hours, 3 days, to sign the DC listing the cause of death after receipt from the funeral director. Okay, and the funeral director, once again, is responsible for monitoring that time. So on day 8, we receive an email alert if we still don't have the information. Why is this important to you all? You're not the physician, but you're the one I'm calling. That's usually what happens. You end up being the one, especially if you work in a doctor's office, or if you're a medical assistant and you're dealing with records and things, you'll be the one on the other end of the line whose nerves I'm kind of getting on. And I understand sometimes that, you know, your hands are somewhat tied, you're waiting on the doctor to do what they're supposed to do. So just ask you to be patient with us, do your part as much as possible to try to facilitate that happening, and then I don't have to call you 2 and 3 and 4 times. Trust me, I know it can be. I've gotten the impression it's aggravating for some people on the other end of the line when they're in that position, but believe me, as much as we have to do as funeral directors dealing with the family and organizing their service, as well as all the paperwork that comes into play, we don't want to have to bug you at all either. We want to be able to move on to the 50 million other things on our checklist. So just want to make you aware of that time frame. They have up to 12 days total to complete, 5 calendar days, plus an extension of an additional 5 days in the weekend if they need it. On the 13th day, they're late, and actually it rarely happens, but the state of Florida can charge at least a $1,000 fine, you know, for it being quite that late. They rarely do that because it rarely gets to that point. But there have been some times when we've had to call repeatedly for whatever the reason, because the doctor is, you know, maybe tied up or too busy, whatever the case may be. But just want to make you aware of that. Also, how medical professional delays hurt bereaved families. Just realize, first of all, the importance of this particular record to the families. I know it may just seem like another piece of paper, but it's not. In particular for cremation, it's very important if the family has chosen cremation. The cremation rates continue to rise across the country, and what happens is that there's a confirmation process that has to take place in order for us to cremate. Once the doctor gives us the cause of death and we enter everything into the system, the medical examiner then has to review the records. It's not like when a person is buried. When a person is buried, if something incorrect is done, we can go and disinter them. But once a person is cremated, that can't be undone. So that's the reason for all of the checks and balances. So it's particularly important that we're timely in getting this information and getting the necessary paperwork in, because we have a family who's calling us and saying, well, where's my loved one? You know, they're wanting to schedule their service. And it really holds. So just imagine if you're the loved one who has already lost, you know, lost their mother, lost their father, lost their child, and this is a process to their closure. And if I'm still having to run around and get this information because it's not being made available, then the family is upset at this point. So just always try to keep that in the forefront of your mind, that, you know, this is someone's family member, and what would you want to happen, you know, if you were in their shoes. So then let's talk about how the issuance of incorrect medical or vital statistic information can cost families and funeral home owners. First, the death certificate, like I said, is required for life insurance payouts to families. That's one of the things that's also extremely, extremely important. Sometimes the person may have a widow, you know, who perhaps their loved one was the primary breadwinner throughout their entire lives, and now they're gone. So they may be counting on this life insurance money to pay the mortgage, to move, to pay bills, you know, so all of this is important. It's like a trickle-down process. When families pledge payment to us through the funeral home with a life insurance assignment, what happens is that the death certificate functions as a promissory instrument, the promise to pay us. So that means that we're waiting to get paid also if we don't have the death certificate generated. And with our pre-need clients, meaning the clients who have come in and have made arrangements, say they know someone is with hospice now. A lot of times they'll come into the funeral home in advance and go ahead and make arrangements with us. And so the funeral home is required by law, if they paid in advance, to trust all money that they've written to us, if they've gone ahead and written us a check, with the Department of Funeral, Cemetery, and Consumer Services. And the state won't release the funds for payment to us until they have a copy of the death certificate. So all of this information affects more than what it may seem like, you know, at the time when we're calling you or when you're calling us. And then corrections to the death certificate, if you give us incorrect information, okay? It's either going to be a medical or non-medical amendment, which means more paperwork that we have to fill out, okay? There's a filing fee, plus there's a $10 per death certificate charge that families pay. So if you give us incorrect information, the family catches it later and says that's not correct, okay? Now we have a responsibility as a funeral home to verify everything, but sometimes families are so emotional, just like you'll be the first time you lose a patient. And I've had people, you know, in an arrangement conference who give me their mother's incorrect birthday. In that instance, that's their fault. They have to pay for, you know, for the changes to be made. But if it's something of a medical nature, say the time of death is wrong, which came from a medical health professional, we have no other way of verifying that information except from you. And I know it may seem like a small thing, but when a family is extremely emotional, as they tend to be, and again, understandably so, they get their death certificate, I'm sitting there across from them, they read it, and I've had them say to me, that is not what time my mother died. You know what that means? They want a new death certificate. And if they've ordered 15, you do the math. That means at that particular point, I have to file a medical amendment because I was given incorrect information. And at that particular point, the funeral home has to eat that. So again, I know it may seem like this stuff is just really not that big of a deal, but you know, that adds up. It can be extremely important, extremely important. Okay. So let's talk about the Department of Health. Okay. Similarly, there are very specific guidelines for infant-related. With the death of newborns, there's either going to be a live birth or a fetal death. Okay. If a child takes one breath, regardless to the gestational age, it is a live birth, and the DC must be filed electronically through what I talked to you about as electronic death record system. A fetal death, according to state law, says that it's a death prior to the complete expulsion or extraction of a product of human conception from its mother if the 20th week of gestation has been reached, and after which such time of expulsion there is no evidence of life, such as beating of the heart, pulsation of the umbilical cord, or definite movement of voluntary muscles. Why is that particularly important? How gestational age affects death registration requirements. If a child reached 20 weeks of gestation, but it was a fetal death, then a paper DC must be filed, which is a lot more work. Thankfully, it's not something you all have to worry about, though. If it's under 20 weeks, but a fetal death, then no paperwork is required. You don't have to file anything at all. So where does that come into play for you all? When you call the funeral home to make us aware of the death of an infant, there are certain key things. You'll notice that this first call sheet looks very similar to the one for an adult, but what I have in bold are the differences. For example, I'm going to ask you if it's a fetal death or it's a live birth death, because what that tells me is how I have to proceed in filing the paperwork. So it's very important that you understand the difference between the two, because when I'm talking to you, I'm depending upon you to be able to give me that accurate information, because unfortunately I wasn't there. I don't know whether or not the child took at least one breath before they died, unfortunately. So part of what I'll ask you, no matter what, is the weight in grams or ounces. And then if it's a live birth, I'm going to ask you the date of birth, okay? The time of death, the date of death as well, which usually would be, in most instances, probably within a few minutes, and then other times they may, it may be a couple of days that they've lasted, or hours even. And then, of course, the time of death. So those things are pretty key. So like I said, that's why it's very important that you understand, the state's, what they say legally is a live birth versus a fetal death. Yes.
Okay, I got a question. Like, what if they gave birth to the child, and say they find the body of the baby in the trash or buried somewhere? Where, how would you know if it took its first breath or not?
That will go to the medical examiner. In that particular case, the baby would go to the medical examiner. They're going to do an autopsy. So then at that point, the medical examiner will have already started the record in EDRS for me, and they will have made all of the findings. So in that sense, I wouldn't even have to be calling you. I'm going to be dealing with the ME. Okay. Good question, though. Very good question. Thank you. In conclusion, I would like to touch on the importance of being willing to serve as an information resource for your patients' families. There's something called referent power, and it means that you end up being a person that people always refer to for information, to be able to answer questions. And having referent power is very important as a potential employee. That's how you keep your job. Okay, when you're the person who goes the extra mile, when you're the person who can be counted on to answer the tough questions that no one else knows, even in your particular capacity, like I said, once your patient dies, your job isn't over. The family is still standing in front of you, looking at you for guidance, even if it's just for that hour until we arrive. We don't expect you to be experts. That part of it is not your job, but it doesn't hurt to have certain information and to be aware of certain things and be able to provide some initial information to families, because they're scared and they don't know what to do. So what I suggest, one of the things that I mentioned, that I listed up here, that you might be able to suggest to families, is just some initial information that they may want to secure or gather before they come and see us, okay? And again, you're not required to do it. These are things that we'll tell them when they get there, or if they call us or we contact them first. But if you're there and you know, because you've been here at this presentation today, they'll remember you for that. For example, one of the things we're going to ask is for the decedent or the deceased person's social security number. A lot of times, they may not know. That's very personal information. Even for a loved one, they may not know their loved one's social security number off the top of their head. the decedent's maiden name in the case of women, the decedent's father's full name, and the decedent's mother's name with her maiden name. Now, a lot of times what will happen is you may know your grandmother's married name, but you may not know her maiden name.
Mm-hmm.
And I know that some of these things may seem like, I never thought about that, and that is the reality. I get people in arrangement conferences, and I have to get this information to enter it into EDRS, and they're sitting in their arrangement having to call an aunt, a great aunt, or someone who knows this information. So, you know, if you're able to mention, you know, these things to them before they get ready to walk out the door to come to see us, what's the harm? Also, wanted to make you aware of the fact that there is financial assistance out there for certain situations when their loved one dies. One of the key ones is for the loss of children. You'll see on the handout there I've listed Angels for Allison is a very key one. And then there's also all types of grief support groups throughout the area that are available to provide solace to families, to provide a community of support for you when you've lost your loved one. And again, you know, right now it may be your patient, but at some point in time, even the people in this room, you're gonna lose someone. You know, and you may need to avail yourself of some of these services that are out there, and they're completely free of charge. And I tried to list them on there as far as what the different support groups cater to. Some cater to people who have lost loved ones due to homicide, suicide. You know, it'll run the gamut, and you all will encounter these things, especially those of you who work in the hospital setting. So if you have the information, you know, you see a person particularly struggling, you have it there and you can help provide it to them. Again, they will get that information from us when they come to the funeral home typically, but what's the harm in giving it to them early if you have? And then finally, what is the takeaway? What is the takeaway? If you don't remember anything else I have said here today, because I know I've thrown a lot at you, and some of it's probably running and dry, hearing about state law and EDRS. I mean, I'm gonna be honest with you. I mean, sometimes it's a little boring for me too. I won't lie to you. But the thing is that you're gonna get trained in that. You know, if you're in the right environment, you're going to get trained with EDRS on some level. You may not have as much interaction with it as I do, but you will be introduced to it. You'll be told about it. You'll be hopefully told about what you need to do to make the first call. So if you forget all of that stuff, what do I want you to remember today? When your patient departs this world, he or she entrusts you with one final task, even if it's just for an hour. You need to provide immediate direction to their loved ones in the crucial moments following them taking their last breath. Facilitate death care professionals in a timely and accurate manner. This is your postmortem responsibility. As diligent as I am certain all of you all will be in your profession in taking care of your patient while they're alive, I urge you to be determined not to let them down in death.